Hey, thanks for being here and for listening to the Plant Medicine for PTSD podcast. I've got a little bit of a different episode today where I'm actually not interviewing a past client, not really anyone with psychedelic experience even, but rather we are learning all about hormone health from Dr. Taylor Bosley. He's someone who has had his own experience of developing operator syndrome, having the crash and the burnout that's associated with it, and then getting his hormones in check and feeling the results. And that whole journey led to him opening his own practice dedicated to hormonal health. He actually has a background in emergency medicine. He has a really, really cool background, actually. So he's double board certified. But on top of that, he was deployed to Afghanistan. I forget the year, I want to say 2011 ish. And he's in the National Guard now in a special operations unit. Honestly, I don't really understand how that works. I don't really know much about the structure of that kind of stuff. I'm a civilian, you guys. But I know that he's a Green Beret, so that's pretty cool. He's got all of that special operations experience. And he's also a medical doctor with specialty training in emergency medicine and in hormonal health and endocrinology. And again, after having his own personal experience with the effects of your hormones being all fucked up, he figured that all out for himself, went on his own journey, and then has turned around and has dedicated his life now to helping other people do the same. So he went and opened his own functional medicine or integrative medicine practice, call it whatever you want. We kind of talk about the differences there. But he focuses on helping people, both men and women, get their hormones in check, specifically to deal with TBI and PTSD, but also just to live a better life and feel better in general. So we cover a lot of really interesting ground in this episode that kind of scratched an itch in my medical brain that doesn't get too much use nowadays, honestly. So I actually learned some of the basics of what he talks about here back in PT school, but honestly, I forgot the vast majority of it. So this was a nice little refresher in some physiology stuff. And more importantly for you, we covered why hormonal health is such an integral piece of the puzzle when you're trying to heal from PTSD or when you're trying to heal from a TBI. So I will definitely be recommending a lot of our clients to go see Dr. Bosley in the future as we work on healing all of the mental, emotional, and spiritual side of things. It's equally important to clean up the physical health side of things as well, and that's where Dr. Bosley can come into the picture. So I really appreciate and I really respect his point of view and his philosophical approach to medicine, and it's very much in line with a lot of my values. So I have a ton of respect for what he's doing, and I think it's incredibly valuable for a holistic picture of healing. So hopefully you can learn a lot from this episode as well. I'll have links in the description or in the notes here on how you can work with him. And if you can't get access to him, you can work with him remotely if you're in the States, but if you're up in Canada, it's not really an option. So I'll have some information about everything that he recommends doing if you can't actually get started with him so that you have some direction on what to look for. So without further ado, let's get into this episode. Thank you very much for being here. Thank you for listening. I'll see you on the other side. But maybe we could start off just with like super short snippet of basically like why should anybody listen to what you have to say. So you are a veteran yourself. You're actually in the National Guard still, right?
That's
You're
correct.
in okay.
Yeah, I'm a
And then
medical
you've been
officer
practicing.
in the
Okay.
in the National Guard.
And
I
you
was enlisted prior, and now I'm a medical officer.
okay. And so you had a deployment to Afghanistan that you told me about, right?
Yes.
Okay. So spent some time overseas, came back, and then talk to me a little bit about your career since coming back home. What have you been up to?
So after I got back in 2011 from Afghanistan, and then after that, it was I went to school, but it was still working. I was still a soldier of the National Guard, so I was kind of doing both at the same time. And then just finished my. I had not even an AA degree when I got back, and so I finished my AA degree, and then did my college 4-year degree at University of Tampa, and then I applied to medical school after that, and then that was 4 years, and then after that I did emergency medicine residency, which was 3 years, and so 11 years total of training is pretty much what it
Hmm.
took to get to the end there to be a board certified emergency medicine physician.
I didn't realize that your background was in the emergency medicine. So how
Yeah.
did you go from that to what you do now? And what would you classify what you do now, by the way? Is it just like
So
hormone health? Is there a title for
hormone
it?
health, integrative medicine, I would say, would
Integrative
encompass it the
medicine.
best. We do functional medicine here as well. I have a nurse practitioner who specializes in that really, and I do some of it, but mostly I would say integrative medicine, where you're using kind of the Western medicine and Eastern medicine together to heal the patient, which is pretty good.
How did you transition to that from emergency medicine? Because that's like very much the opposite end of the spectrum. I feel like Western medicine is great for like trauma and acute trauma and stuff like that. Not
Yeah.
so great for everything that you're doing now. So it's kind of cool that you've blended these different approaches. So how did you make that transition?
Yeah, no, that's a good observation. So I feel like working in the ER, you're kind of it's great for what you said. Like if you're having a heart attack, if you're just got in a car accident, you're having
Yeah,
a
dude.
stroke and you can't move on one side, go to the ER. That's great. We can help you. We can get it fixed quick. But it's the what are we doing to help these people not get in that situation, right? Prevent that because you get kind of jaded when you're walking around the emergency department and you're treating all these sick people all day that you feel like you're doing damage control almost. Whereas
Mhm.
you think back and I go home and reflect and I'm like, how can we prevent these people from ending up here in the first place? Not that I don't love the ER, like I love working as an ER doctor and it's very cool. You do get some MacGyver moments where you have to save the day and work with what you've got. And I work in rural medicine, so I don't have a lot of help out there. Sometimes it's just me and a couple nurses. So we do what we can, but what can we do to help these people not end up in this situation? And I think that the baby boomer generation kind of lost that. And then now we figured out like we don't want to end up like them on dialysis and on 10 to 50. I have patients on 30 or 40 medicines where it's
Yep.
crazy. You're just like on medicines to treat side effects of other medicines. And it's not that these medicines don't work, they do, but how have we gotten in this situation? And so I figured I was like, there has to be a better way, and so I did the ER doctor thing full time for 2 years. And then I realized like I feel like I want to help people not end up here. So that's why we opened our practice called Precision Wellness Group. I was also went through a hormone crash myself around that same time and got on hormones. And that opened my eyes to this whole other side of medicine, which just like blew my mind, and I was like, there's so much to learn about beyond just regular day-to-day medicine. And so that's what really was the impetus for us.
It's interesting. I mean, it's unfortunate that you went through that crash and probably kind of burnout along that same time frame, but it doesn't surprise me, man, because like working in that environment's got to be so stressful.
Yeah.
I've got a friend who's a corrections officer, and it's like I'm in prison all day.
Yeah.
So as an ER doctor, like you're in these emergencies all day long. That's got to fucking take a toll on you just by itself.
Oh, yeah, and you get really jaded from it because you're getting people who come in there like psychiatric patients trying to throw their urine on you. You're dealing with, doing CPR on a 5-year-old and then telling their parents that their kid's dead. Both parents are throwing up on the
God damn,
floor.
dude.
It's pretty grim stuff, man. And it's
Holy
hard
shit.
to digest a lot of that. So I think ER is great in small doses, but you can't like do it every day, because you just get too burnt, just like anything else. It's high stress. But no, I love the job, and it's very necessary. I do think, but I think there's more that we can do to help people who want to be helped. Is if I could put it bluntly, I feel like we
Yeah.
do. There are people that show up to the ER and say, they just you're going to do cocaine until they're 60 and they're going to do whatever and they're going to show up and say doc fix me, and that is what it is. But there is a huge, I think our generation has flipped it a little bit and now we're like, okay, we're going to do the sauna, we're going to sleep 8 hours, we're going to eat healthy foods, whole foods, not eat these processed crap now. And they come here like wanting to change, which is super cool, and that motivates me to help them. So I really like that side of it.
Yeah, I think you're right. The times are definitely changing in that direction, especially with the cold plunge and sauna, like you said. Like everyone knows about that now.
Mhm.
But I imagine there's still like some degree of resistance as you were making that change, like in the medical field itself. But I guess you went out and started your own practice. So you didn't have to deal with any of that. You just said, fuck it, I'm going to do my own thing.
Yeah, no, definitely. I still work in the ER. Yeah, I work there on Wednesday. I
Okay.
do I do a couple of shifts a month just to keep it up, and I do enjoy it. Like I like the people there and everything. I just think that it's not healthy to do all the time.
Agreed,
I was
man.
working an unhealthy amount of hours, which is probably twice as much as most ER doctors work. And it just not good for me, not good for my family, and not good for the patient. That's what really matters is like, if I haven't slept and I'm doing 8 night shifts back to back, like, and I haven't slept well, like that's not good. I
Yep.
can't take care of patients great that way. So
Yeah, it's a
it's a
little bit of a
balance.
broken system.
Yeah.
All right, so talk to me about your practice now. Like why do people come to see you? What are they coming in for?
So we have kind of a strange patient demographic, which is really cool actually. So we're close to Fort Bragg, so we get a lot of special operators, and that's the reason I opened this practice is because I was a I was special forces medic before Army Special Forces, and had a lot of explosions. I had head injuries a lot like through training, and I don't know, maybe that contributed to my hormone loss, but when I got on back when I got my hormones corrected, I was like, wow, this is such a cool thing. I feel like I could
Mm.
other guys out there I'm sure need this same thing. And so that's why we ended up opening the practice, and it's close to Fort Bragg, so we get a lot of special operators here. And so that was like the reason we started it, is to like pass on the goodness that I was experiencing. And it started with just my wife and I started this by ourselves. She was the office manager and I was the physician, and we just did it all while our kids were at school. And now it's grown, but we we started it to help out the operators, and then it was like the operators would come back and say, "Oh, cool, man! Like I feel so much better. Thank you. I feel effing awesome." Like, and it's cool to hear that. Like guys were like, I was considering suicide, and now I'm not. That's super cool to fix that. And then, but they came back and they were like, "Hey, can you fix my wife as well?"
Mm.
And so we started treating women, and we've in a year and a half we're at 600 patients, and three of them or excuse me, we just pulled the metrics. It's 49% are women, which is pretty cool.
That's awesome.
Mhm.
It's so funny what you described because we see a similar thing where like a husband and wife will come to us and the wife is just in support mode of like my husband needs help, like whatever he needs, like just please help him. And then 6 months go by and he's so much better. And then she's like, well, wait, like, can I do that too? Like what just happened to him?
Yeah, can
So
you
I
fix
love that
me?
this yeah, exactly. I love that the same thing happened to you. And this is exactly what I want to get into today with you. Basically, the hormonal angle of managing TBI and PTSD. Before I actually get into that, so you run your clinic with your wife. I want to hear about that real quick, just
Oh
completely
man.
selfishly, because I run my business with my wife. You guys are a
Right.
bit ahead of us in terms of like age. Your kids are older. You've been doing this longer.
Mhm.
How has that experience been for you? Pros and cons.
Oh, good. That's a great question. So, it's rough when you dive into it. You're like, are we going to be able to get along with each other all day, every day? Because you have to go home with that person and do dinner and then sleep together and all that. And so
Yep.
sometimes you like it's a healthy break going to work, but no, it actually worked out really well because I'm in here in my office seeing patients like most of the day, and she's out front talking to patients, enrolling them into the system, calling them back about their medications, things like this, where we have two very different jobs. And so we're
Mhm.
actually, even though we're in the same building, we're not crossing paths a lot during the day, just like quick questions and whatever. So I think if we were in the same room a lot, it would probably get old. But we've been together 15 years, so at this point, we're
That's
pretty used to
awesome.
each other. Yeah, no,
All right.
it's
So
good. Juggling the kids at work was rough. In the beginning, it was like three beanbag chairs in a office in our break room with like a TV, and like in the
mhm.
summertime, it was rough, man. But we get through it.
So clear division of labor and
Yeah.
have a place for the kids to go. We're lucky we have a nanny, and I mean our daughter's pretty young. We both work from home, so we're just all home all day. But yeah, I love that. I feel like periodically we've had a discussion like every 6 months where my wife is like, "Is it a good idea for us to run this business together?" And I keep
Yeah.
saying yes, so I have to keep convincing her.
I know how it goes. Like we literally got into a small, I wouldn't say an argument, but a disagreement this morning, like leaving the house. It just happens
Oh
about
yeah,
work,
oh yeah,
and
oh yeah.
people are always like, you should separate work and you should just stay like home is home.
It's
There is no
hard,
such
dude.
thing when you're an
No.
entrepreneur. Like she always says, like business talk at home is foreplay. She like we because we love being entrepreneurs and we love doing this. I think it probably gets a little unhealthy at times because you're just like hyper focused on it.
Yeah,
But
but I think that's what it's got to be if you're going to be successful. And how amazing. I think what a blessing it is that you and your partner are so dedicated in the same direction with the same vision, working towards the same thing. Like I can't imagine it being any different.
yeah,
So
no,
I
it's
like
super
that.
cool. I think it would not work at all if it wasn't like that. There's no way
Yeah.
because if she didn't
Yeah.
support it 100%, there's no way. There's no. It's kind of like women or like military spouses. They can either do it or they can't. Like there's no in
Hmm.
between because it's so hard for the woman to deal with 15 deployments. It's like and deal with the kids all by herself. So they can do it or they can't. And luckily, our wives can do it.
Yeah. Yeah. That's a really good analogy, actually. It's a good point. And yeah, last night, like 10 p.m., like we said our evening prayers. My wife's eyes are closing, and I'm like, "Fuck! I have a question about our marketing strategy. Like, I need to ask her because I had a mentorship meeting at 5 a.m. today with our business coach, and like I needed to ask her something to ask them. She's like falling asleep talking about Instagram ads. I'm
That
sorry.
happens all the time with us. I know she takes progesterone before bed, and I can just like see her go down, and I'm like, all right, whatever. We'll save it for the morning.
That's awesome. All right, so let's talk about what we're here to actually talk about. So
Sure.
I'm actually curious, first off, how do you even define these issues? Because like I feel like PTSD has become a somewhat polarizing term. It's like PTSI, post-traumatic growth. So like, how do you think about that? And how do you classify PTSD and TBI from your lens that you look at things through?
So I would say like the big buzzword now is operator syndrome is what people
Hmm.
are they're using. So that's kind of an umbrella of things. And there's a good that book if you've ever read it is pretty good. There's a paper first, and then he wrote a book on it. I forget his name, but he wrote it. I think he was a military physician, and then wrote this book called Operator Syndrome. But it talks about all these features of these guys, and it's kind of it's the guys getting to like I'm 41, it's the guys that I typically see, which are 37-ish is when it starts happening, and then 37 to like 45 at the end of your career, and it's these soft operators, whether they be SEALs, Delta guys, Green Berets, whatever, that get to the end and they're have these issues, whether it be hormonal issues, these depression, anxiety, all these things. But the crux of it is it comes back to the traumatic brain injury, and it's cumulative. It's not just one explosion. They're saying that like even firing your rifle is a micro
Yep.
trauma to the pituitary. So you're dealing with that, and then add all these other ones from like all the airborne jumps and free fall jumps I've done and smashing my head to the ground. It's you get these cumulative damage, and then it finally hits you at the end of your career, and you end up in this situation that these poor guys, and then they go to the VA, they get out, they go to the VA, they get on antidepressants, and then they can't, they have no libido, and then they have erectile dysfunction, and then I see why they get so down. It's super sad. So that's kind of the typical person that I see with that, and that's what operator syndrome is. It's cumulative head injury, and then resulting in all this condition at the end.
Is because I've heard that term, but I haven't read the book or dived into the research on it. So is that it's almost like a catch-all term, but it's kind of attributing most of it to the TBI. So it's
Yes.
not even so much the psychological things, the moral injury, the grief, that kind of stuff. It's like this is almost I don't want to say all biologically driven, but focusing on the brain injury aspect of it.
Yes, exactly. That's like the underlying portion of it, and then you
Okay.
get you get to this. It's weird because it's like a perfect storm. You get to the end of your career. You've been a Green Beret. Let's use the Green Beret as an example, just because I'm one and I can relate. You're a Green Beret. You've been doing this for 20 years. You get to the end of this career. You're 40-ish years old. You're ready to retire. That was your whole identity, and
Oh
now you're
yeah.
getting out of the military, and you're just like nobody cares in the real world what you did. You have to start over again and then work your way back up this ladder and prove yourself again, and climb. And it's just like then on top of that you have this brain injury, these multiple brain injuries where this hormone dysfunction, your testosterone's 200. You have no drive to go do anything. So I think that all comes crashing down with that identity crisis, the head injury, and then the poor mood, and then you end up in this situation where it's just like blah, you know.
Yeah, and I think we're starting to catch up to realize cumulative like micro traumas to the brain. Like you said, just the blast from firing your rifle is an insult to your brain.
Hmm.
And man, I've spoken to some guys who are like range instructors where they spent, like 8 hours indoors firing weapons all day long.
Oh
Like
yeah.
now they've got the toxic exposure from like the lead and all the heavy metals and stuff on top of that. It's
Yeah.
it's crazy. So yeah, I think people are starting to catch up to realize that.
Hmm.
Um, but we're not really doing anything about it to prevent the next round of people from experiencing that. And what are we supposed to do for the guys who just spent 20 years in the global war on terror? And like you said, now they're home and their life is falling apart. So can you talk to us just from like the hormonal perspective? What gets disrupted, right? So what is the mechanism by which all of these things start to actually happen in their life as a result of that cumulative stress or cumulative impact on the brain?
So we call it the HPA axis, where it's the hypothalamus, the pituitary, and then the adrenals. And that's what's getting, when you get your bell rung, that's what's up there. It's very sensitive. So the pituitary, think of it as like this little acorn that sits in this protective case. And this case is a little thin walled case. And that thing just dangles in there inside the brain, if it's like straight back here. Now, that gets jiggled enough and then gets traumatized enough, and it messes up the signals that are actually sent down to your testicles to make the hormones. And so two of them that specifically are luteinizing hormone, which makes testosterone, and then FSH, which is follicle stimulating hormone that makes sperm. Those are, so I find some guys that just don't make them anymore. That's the disconnect, is there's no hormone coming from here to here. And then the other version of hypogonadism is if your testicles don't make it. So it could be either the testicles don't make it because of toxins or exposure or whatever it was, or you've hit your brain enough where that doesn't send the signal. So that gets like physically, anatomically disrupted, and then you don't make that anymore. And so you have to replace it either way.
Does it kind of all just tie back to testosterone? Like, is that the downstream effect of all of this?
It is, but it's also cortisol too. So when you lose your testosterone, you're basically running on cortisol. So that's really high, and it deals with your stress. Like when I first was learning about this, one of the instructors was like, testosterone handles your stress. So when your testosterone drops, your cortisol comes up to manage it. And
Mm,
cortisol is great when you're supposed to spike in the morning when you wake up, and it goes up and then it comes down, and then it should be flat the rest of the day. But you end up with these guys who, because of PTSD, because of the head injuries, they end up with this multiple spikes of cortisol. Specifically, the worst one is when you're spiking before you're going to bed, because you're lying
mm.
awake with that wired and tired, staring at the ceiling, but super revved up, but you're exhausted kind of
Yeah.
feeling.
Yeah. Okay. Wired and tired. I've never heard that before. That sounds like a good way to explain this though,
Yeah.
because cortisol it's always associated with stress and like feeling of fatigue. But I know that with our circadian rhythm, that's actually what prompts you to wake up is that spike of cortisol.
Right.
So you're saying when you have that spike or when you have that throughout the day, that's what really jacks up your sleep and your circadian rhythm.
Yes, that's one version of it. But you could
Okay.
have the one that's pretty indicative of PTSD is when you don't have it at all. So you can have a flat, like it never spikes in the morning.
Interesting.
And those are the guys that
Okay.
just wake up and they're just, all day long, because they don't ever have that spike where it wakes you up and you get motivated in the morning and ready to go, and then it comes back down. But they don't have that at all. It's just totally flat. That means the adrenals are burnt. Like they're not pumping anything out anymore, and you're just barely going through the motions.
So if there's one thing that I remember about all of this from my physiology classes back in PT school, it's
Hmm.
that there are so many complicated feedback pathways where
Hmm.
like the hypothalamus is controlling various things getting released from the pituitary, which is controlling various things being released from the adrenals, and then your body is monitoring the blood levels of all these things. So it's like this recurrent feedback system, right? With positive and negative reinforcement to try to fine tune our blood levels of these things. And so you're saying that when there's this insult to the brain, disrupts that axis. So maybe we're not signaling the adrenals to operate well, or perhaps them, like the glands themselves, are not operating well, right? So it's
Right.
almost like there could be both things going on. I have to imagine there's like a whole other cascade of effects that maybe we're not even super aware of because we can kind of focus on affecting the testosterone because like that's within our control in terms of delivering medications. But what other effects might come from that insult to the brain? Like, are there other things that you guys look for outside of the testosterone and the cortisol that contribute to how someone feels?
Yes, so we kind of take a whole patient approach to it. I do a lot of lifestyle stuff with people because
Okay.
there's a lot of other factors to than just hormones. So think of this as I always tell people, think of this as like a children's puzzle with the big pieces. You have to get every piece right for you to feel 100% again. You can't just like fix a guy's hormone. Like you can go $99 a month online and get your hormone and get your testosterone. That's great. But if you're still eating like crap and you're not sleeping 8 hours and
Yeah.
you're not exercising properly or you're exercising too much, you end up in this like, you're not fixing the actual problem. So vitamin D is a part of that. B complex. Like you have to get pieces of that puzzle right. Thyroid is a huge piece of it. So there's another one, right, that gets injured. And that can be from toxic exposure. It can be from leaky gut. It can be from a lot of things. So we always check thyroid as well. That's a big one. And I recently put a guy on thyroid and he's like, oh my God, I feel like the lights came back on. He's like, I've been to 7 different doctors and none of them could figure it out. And I've been on testosterone for 5 years. And once I got on the thyroid, man, it like changed everything. So,
Okay.
there are different, and sometimes you just have to try things with people because they've been to other doctors and they've had the stellate ganglion block and they've been to on ayahuasca 30 times, but sometimes that isn't it, and it's not just one thing. I think we have this magic bullet type of thing where we're looking for that one piece to the
Yeah.
puzzle that's going to fix it
100%.
all, but that's not it. It's multiple things. It's you are you detoxing well? Are you eating enough vegetables? There are different, it's all goes together.
I'm glad that that was your answer because I asked that question thinking like it feels kind of reductionist to me to just look at testosterone when your brain is controlling absolutely everything.
Yeah.
So it can you almost attribute like can you hear someone describe their symptoms and say like this is a testosterone issue or this is a thyroid issue? Or it sounds like no, like you said, you have to see what they've tried, the effect that it had, what their blood panels are telling you. Is there a degree of kind of like trial and error? Or are you
There
able
is.
to like look at yeah,
Yeah,
okay.
there totally is. And, I have a 60-year-old Delta operator I'm treating right now who has chronic fatigue syndrome and he has a brain tumor. That guy, I don't know what the brain tumor is pressing on because I haven't seen his MRI yet.
Right.
He hasn't been able to produce it. But I've tried so many things on him, and I'm still trying. But I feel like we get him a little better with like each little thing. We just try to bump steer it. We're adding, we're subtracting. So it's not just and like you said, it's not just guesswork. I mean, we have the labs. This is an art and a science. The art is you listening to the patient and their symptoms and figuring out like trying to put together a plan based off that, and then use the labs, which is the science, to help guide you in that direction.
Mm.
But
Do
a
you
lot
have
of
any
what's that?
I'm sorry. I'm
You're
sorry. I didn't
good.
mean to cut you off. Finish
You're
your
good. You're
thought.
good.
I was going to say, do you have any like kind of like pet theories or hypotheses that you have developed from just the personal experience, like anecdotal experience of seeing all these people that the science and the literature maybe doesn't support quite yet? Because like the physical therapy world, the literature is a nightmare. Like
Yeah,
there's
I'll
stuff all over
bet.
the place, and like everyone wants to be evidence based. And like if you look at the evidence, you actually shouldn't be doing anything at all, right?
Yeah,
So
I know.
like what have you found that maybe the science doesn't support yet, but you kind of believe in it?
So this whole hormone thing in general is like there's just
It's
no.
very new.
Yeah, it's new, but I mean, the first pellet they put in was 1930s. It's been around for a long time, but it's been so outside of regular medicine that no, I mean, endocrinology is a specialty. You have to go to training for 3 years to be an endocrinologist, which on top of your other training. So that is, and they do, but they stay like within their lane. There's no guidance to like, they're not going to go outside of their lane and try to work to fix this person that nobody can figure out. It's just like, oh, sorry, the book says you can do this, you do that.
Right.
And I'm not crapping on endocrinologists; they're great people. But there's um, you get to this point where, especially when you're learning about this, because I've taken several courses, I'm board certified in anti-aging regenerative medicine. But there's so many people that do it so differently that, like you said, it's like information overload. There's so many people that are like, do this, no, don't do this, no, do this. And no, I do it this way because this is the right way. So there's there's no consensus on how
Right.
to do this. So that's why I say this is very much an art where you treat. I mean, now at 600 patients, I feel like I kind of know by what they're saying and like what symptoms they're talking about, like which direction we're gonna go with it. But that wasn't something I figured out right off the bat. It just comes with
Yeah.
experience, just like anything else.
And I mean, I hope this is better, but if it's like physical therapy, then every person has a course to sell you or a certification to sell
Oh
you, or
God,
like
yeah.
their, you got
Yeah.
to sign up for their method to get the three extra letters after your last name. It's all crap.
It's so crazy, and
So,
it's such a waste. It's such a waste of money. And people like
oh
I
yeah.
like mentoring people, and I people that want to go into this. Like I have a lot of PAs that come to me and they're like, "Hey, I want to get out of regular medicine. What do I do?" And I'll point them towards the right courses because one, I don't want them to waste their money, and then two, I want them to get the most bang for their buck for these courses. And some of these ones I wouldn't do again. It's not. I
Hmm.
would if I had to go back. And some of them I spent 14 grand for. You didn't, to do it to get the
Totally.
certification.
Totally.
But then like Monday morning, I'm like, okay, so what's the protocol? Like now
Yep.
I'm more confused now than I was before. So
Yep.
I don't know.
Dude,
It's trial and
I had
error.
so many certifications I only got because my boss had a budget for it, and I was like, if I'm spending the clinic's money, like I'll go take this course, but I'm not paying for this out of my own pocket.
Oh yeah, I mean,
Back
get it.
back in the
The more
day.
you can get, I feel like you. Now, I'm not saying you don't learn anything from these, right? You probably learned some kind of nugget of
For sure.
knowledge from
Yep,
there,
for sure.
but it's not as far as like bang for your buck. I've probably spent
No,
after being an ER doctor, just getting into this industry in the last 2 years, probably spent $30,000 of my own money
that's
just on
awesome.
education. But that's when I went into this, I didn't go into it to be like just another hormone guy ripping people off. I wanted to be the best, like in the area, and in now we're licensed in 30 states, so in the nation. So that's my goal is to just be educated more than everybody else on this topic.
That's awesome. Are you familiar with Naval Ravikant? Do you know who that is at all?
No, I've never heard of it.
He's like a philosopher and investor and author, and he's awesome. I love his stuff. But there's one quote that I think about a lot where he says that you have to decide to be the best in the world at what you do, and then keep redefining what you do until that statement is true. So like you
Yeah.
want to be the best in the world endocrinologist for this specific population, and you keep redefining your practice. And I feel like you're actually probably there already, but that's cool. I like
Okay,
the
cool. It's an
dedication to it.
awesome. No, it's a really good quote, and I feel like I relate to that a lot. And
Yeah,
right when because to your point, like right when you think you got it figured out, you realize like, oh man, there's so much more to learn all the time.
absolutely.
Like I don't think I'll ever stop going to courses and like taking them because there's just so many different directions to do it. I mean, even peptides, add peptides on top of that, and that's just the Wild West as well. And then you
Hmm.
can't get some of them, and they're not regulated, and you can buy them from China. Should I get them from China? Should I not? Like it's
Yeah,
just
dude.
so crazy.
You're buying a vial that says not intended for human consumption on it.
I know it says for research purposes only or for animal
Exactly,
use
exactly,
only. It's like that's probably not a good
exactly.
idea, guys. I know it's cheaper, but I had a woman who was doing that. So I put a pellet in her, and we did her hormones. It looked good, and then she was coming back before her next one, and I do like a trough level to see it. And her, so a woman should be total testosterone about like it shouldn't be very high. Hers was like 500 total testosterone, well in the man's range. And I was like, did you by chance take anything else? She's like, oh yeah, my husband gave me one of the peptides he got online. I was like, okay, cool. Well, there we
No.
go. So if you have a goatee, it's not my fault.
That's awesome. All right, so what have you seen? Kind of going back to your clinical experience so far. What kinds of things have you seen being misdiagnosed, where someone sees their family physician, or I feel like the majority of these people getting put on SSRIs and just told that they're sad and they have a Prozac deficiency. So what are the kind of the most common things that you see where people have gone wrong with other doctors not looking for the right things?
I can go for men and women on this one. The
Sure.
biggest one, I'm going to go with the elephant in the room. I know we're talking about special operators and all this, but women, huge problem. So they end up in the American College of Obstetrics and Gynecology thinks that you should put them on depression medicine when they're going through menopause. But like you were talking about a minute ago,
Is
like
that the recommendation? That's
yeah,
like the
it's one of
actual
them.
recommend.
Yeah, to
What the
do that.
fuck?
Yeah, it's like she doesn't have a Zoloft deficiency. She's missing her hormones. Just give her the hormone back. So I'll give you the 10,000 foot view for women. They typically lose their testosterone in their 30s, typically after their second kid. For whatever reason, after the second kid, it just drops off. And this isn't every woman. I'm just talking broad strokes. And
Sure.
they lose their progesterone in their 40s. Now they can't sleep. Their periods are heavy. They're all over the place. And now they're staring at the ceiling and they can't sleep. And so the next day they have a lot of brain fog. They're very irritable. So they're getting in a fight, getting little tiffs with their husband. And then that's in their 40s. I'd see it like late 30s, early 40s. And then 51 is the average age of menopause when they lose their estrogen. And then you hear about like the classic hot flashes, brain fog, those kind of things. The number one sign of losing your estrogen going through menopause is joint pain. So women will
Hmm.
have this joint pain out of nowhere, and that they never had. Like, oh, I must be because I'm getting old or whatever. But women will go to the doctor and they'll be like, oh, this is just part of getting old. You need to clean up your diet and do some exercise, which is great. But like the woman needed hormones 20 years ago, and now we're just kind of patching it together. So that is misdiagnosed all the time, which is uh, they're misdiagnosing menopause and symptoms of hormone deficiency because I think they're scared to treat it. Ever since that article came out that was the Women's Health Initiative that came out that said hormones cause cancer, but the two hormones that they used in there were not the same hormones that we use now. So ours are bioidentical, a lot safer, and there's many options that are very safe for women. They're actually about to take the black box warning off vaginal estrogen, which is awesome. I mean, women die from UTIs. I see them in the ER all the time. Older women, I'm talking about, but they could all use estrogen. So that's a big missed thing with women. Men, it's the classic: go to the VA. I can't do this. I have no muscle. I have no, I can't get rid of this fat. My penis doesn't work. All these things. Okay, let's give you erectile dysfunction medicine. Let's put you on a depressant. Man, you sound depressed. Your testosterone's 350. Man, that's normal. You look good. That's within the range. And the range starts at my range is 280 to 1100. So do you think that
Wow.
guy who is at 285 feels the same as the guy who's at 900 or 1000? Like, no, he does not. So that's misdiagnosed all the time. And I'm not saying testosterone is the answer for everything, but I feel like in men, you should start there before you go down this road of putting this guy on an SSRI. SSRIs are not meant to be used long term. Those is a short term medicine. If you can't put someone on it for 20 years. So fix the actual issue that's going on. And if it's not testosterone, keep looking. There's just something else. But there's also like behavioral health needs to happen too. This guy like needs counseling. This guy needs other things. Maybe plant medicine. I don't know. But there's plenty of other avenues. But that's a big one for sure in men and women.
Can we go back to the women example for a second with the menopause? Because I'll admit my ignorance. I know fucking nothing about menopause, but
Yeah,
it's something that we
not many
see.
people
Oh,
do,
okay, fair.
including
Makes me feel
doctors.
better. Every female client that we have, though, is right there in that age range and is experiencing some degree of that.
Mhm.
So if you're saying that like the treatment approach is to deliver hormones because menopause is basically their hormones are starting to drop off, isn't that like actually though a normal part of aging? Isn't that a normal biological process? So
It
is
is.
delivering hormones trying to just mitigate the severity of it? Is the idea that like modern humans, like our environment doesn't match our evolutionary biology, so it's hitting us too hard? Like what is the theory behind treating it that way? Because isn't it just a normal biological process?
It is. And I'm glad you used the word theory because that's really what it is. So the theory is that women weren't supposed to live this long. But due
Mm,
to advances in medical care, women can now live to 80, 90, 100. But they lose their hormones at 50. That's half of their life they spend with no hormones.
right.
So why do we put women on hormones? Because the main reason, the top three, is to prevent dementia, to prevent bone fractures, and to prevent heart
Mm,
attacks. So the minute they lose their estrogen, which is perimenopause is when they start to lose it, and then menopause is when they've lost it. The definition of menopause is 1 year, 1 calendar year with no vaginal bleeding, with no menstrual cycle. And so once they've hit that, they've graduated now to menopause, and they don't make estrogen anymore. What does estrogen make? It makes nitric oxide, which keeps the arteries open. So a woman is protected from heart disease or from heart attacks until she loses her estrogen. And then she has the same exact
shit.
risk as her husband for a heart attack at that age group. So
Huh.
that's why we give it to them. 50% of the benefit that men get from testosterone is actually from estrogen. Estrogen is very important in men too, just like testosterone is very important in women. Women actually used to make, when they're young, they make more testosterone than they do estrogen and progesterone put together. So you
Interesting.
need, both of you need those things. It's not just a men's hormone, it's not just a woman's hormone. So that's why it's really important for them.
I had no idea that it was part of nitric oxide production. So
Yeah,
like heart attack risk and stroke risk go up. That's
exactly.
crazy.
So when you're a
And it,
bodybuilder, oh, sorry, go ahead. I didn't mean to
no,
cut you off.
I was gonna say what you've shared also of like women aren't supposed to live this long. Like none of us are supposed to live this long.
Right.
Kind of makes sense. Like evolutionarily, we should be having kids at like 16 to like 25, and then probably die by the age of 50.
Right,
Sorry.
exactly. Get eaten by a tiger or something, like,
Yeah.
or die in some battle. But
Yeah. Right.
yeah, it's just like, are we going to let these women suffer? Because it's not about longevity. It's about, or not longevity. It's not about lifespan. It's about health span.
Health span. Yeah.
Because let's take my grandma for instance, morbidly obese. She would golf once in a while, but she never worked out. She would eat whatever she wanted. And she's a great woman, love her to death. I'm just talking like how her life ended and how like I've learned from this. She had a massive stroke in her 80s and lived in a nursing, paralyzed on one side, and she had broca's where she could
Oh,
receive but not transmit, so she
beautiful.
couldn't speak. So she's like, it's like charades, all the time. So
Yeah.
she's trapped inside her own body, and she couldn't write either. So the brain is very, very crazy. It's interesting how it worked because she could sing but she couldn't talk. It was really, really strange. But anyway,
Dude.
13 years she lays in this nursing home, morbidly obese, can't move one side of her body. Finally, until COVID hits, no one could come see her, and she starved herself to death. That is in her 90s. She's like in her late 90s.
Damn.
Super, super sad way to go. Like I think about that and I'm like, I just I don't, that's not, did she live till 90? Yeah. But what was the end of her life like? She wasn't out like hanging out with her friends, traveling to Italy, like that wasn't it. I don't think that people like want to live like that. So we try to prevent that from happening. And that's what health span is how many good years do you have, like healthy years where you can like get on the floor and roll around with your grandkids. That carry the groceries in. I always tell women all the time, I'm like, you need to eat more protein. You need to be on hormones and you need to lift weights. That's the way it goes because I need you to be able to carry the groceries in when you're 80 years old. And when you trip and fall, you need to get back up because you're going to lay there on the floor. Me working, come shadow me in the ER and I'll show you that same woman every single day who can't get up.
Yeah.
Oh, she can't, we do drop her off because, you know, Dr. Bosley, we can't take care of her anymore. She's like still sharp. She can still balance a checkbook, but she can't get to the bathroom. She's just too weak, and that woman goes to a nursing home and then she degrades over the next couple of years. And it's bad. But that's the cycle you see all
Terrible.
the time. So what can we do to prevent that? And then that's hormones help prevent that.
Is there is part of the idea with the hormones and with menopause, is there almost like a critical window where you can maintain some of this? Like for instance with bone mineral density, it's like you build it until you're what is it like 30, 35, and then it kind of starts degrading. So is there something like that where you can almost catch it like too late, or it's better if you begin earlier?
You can catch it right before it happens. So the time when you lose the most bone as a woman is during the perimenopause. That's when your estrogen, before that, her estrogen was very predictable and it would go up and down, these predictable patterns every month. Now it's doing this. It's called the zone of chaos for a reason because it's going up and down
Zone
and
of
up and down.
chaos.
Yeah, I'll check some women's and she'll be 400 estrogen, which is crazy, like super high. And then I'll check it 2 weeks later and it'll be like 5. So it
That's
goes up
crazy.
really high and really low, but that fluctuation in there. And then remember, she's in her late 40s, early 50s, and then she lost her testosterone a long time ago. So testosterone and estrogen are synergistic for bone building. So now this woman is losing a lot of her bone during perimenopause, and then she gets to menopause, she doesn't have estrogen, she can't build bone anymore. I don't care what kind of medicines you give her that are big pharmas, they're not going to help. You want that bone to be nice and strong but pliable, and that's what estrogen and testosterone do, like carbon fiber. You don't want it to be like porcelain, where that's what those medicines, they end in dronate, a lot of those ones that they use for the bones, because I see this all the time in the ER. The lady's on the medicine, but doctor, she's on this medicine to prevent her from fracture. She falls and it shatters into 1,000 pieces. Like, how do you put that back together? That's what happens with that bone. That's not the kind of bone you want.
That's interesting, man. As you're describing all this, I'm having a flashback to cadaver lab in physical therapy school,
Yeah.
where our one cadaver is like tiny, frail old lady, and I remember her bones fracturing just from moving her, rolling her over, that kind of thing, and yeah, like
Yeah.
severe osteoporosis. It was crazy. It was like, I mean, it's super gross actually to like feel a bone fracturing under your hand
Oh,
as
yeah.
you're just like
It's yeah, the
moving a
crepitus
body.
of it. Yeah, no.
Yeah,
Or a
dude.
broken jaw, you
Yeah.
feel it. But
Oh my gosh.
yeah, no, so I'm glad you got to see that side of it because that woman didn't get there overnight. That
Oh
was
no.
30 or
Yeah.
40 years of her just declining. And so you can actually give women back their bone density by giving them hormones, which is super cool. So we're moving to a new office soon and we're gonna have a DEXA scan there so we can actually do an annual
Cool.
DEXA scan on these women just to prove to them that we're getting their bone back. And most of them go get one anyway from their doctors. So, but it's just more to come on that.
Yeah. All right. If you were to design like the most ideal treatment, like holistic kind of a treatment program for somebody, like let's use like the operator syndrome example, because
Mhm.
the typical pathway is they feel like shit, they go to the VA, they get all these drugs that don't really help them, or maybe they see a family doctor and they don't really get great advice, and then they end up seeing you after stuff hasn't worked for 10 years, right?
Yeah.
So if you could kind of design an ideal paradigm, what would that look like? Would it start with the hormonal stuff as a baseline and then go into the therapies and things like that? Like what would the most ideal flow be in a perfect world?
I think that you start with the lifestyle stuff right away. That's the
Okay.
thing. Because a lot of these guys have bad habits, and some of them don't know they have
Yeah.
bad habits, and you have to
Yeah.
teach them that they have bad habits. So that's part of it. That's why my consultations are an hour long, because I'm not just like, hey, dude, your hormones are low. Do you want to give shots or not? That's how it was when I went as a patient, and I was like, this is crazy. So I think that it has to be like, how do you sleep? What do you do? Is it dark and quiet? Do you have a cold? Is it cold? Are you a hot sleeper? Do you toss and turn? Do you
Hmm.
snore? Have you been evaluated for CPAP? Those things like that's just sleep. Then like what? Tell me how many meals a day do you eat? Are you snacking in between those meals? Are you having trouble losing weight? That may be why. What do your meals consist of? Are you eating a gas station burrito every morning for breakfast? Some people do. And so
Yeah.
people don't know, and you have to tell them. And then
Yeah.
they'll be like, oh my God, I've got so much better since I've stopped eating that gas station burrito. So
Dude.
it's like you start with that stuff, and then people like I had a guy the other day that just does cardio, and I'm like, you have to do some kind of weight training with it, or you're going to get too inflamed. And so I teach them about inflammation. I teach them about like not. I'm not just saying like you're a bad boy, don't have that diet, that 7 sweet teas a day. Like I'm
Yeah.
telling you what the sweet tea is doing to your body because we're going to look at your CRP on your labs and we're going to put it all together and teach them. So to answer your question, like lifestyle first is what we do. And then we're going to look at your hormones at the same time and see what we got to do. But if that doesn't do it and you come back to me and we've been together a year and that's not it, then maybe we got to do some other stuff, man. Maybe you need some therapy. Maybe you need some plant medicine. Maybe you need some ketamine treatment. I've had multiple guys sit in that seat and be like, Doc, I used to be an alcoholic. I haven't touched the stuff since I got back from my ayahuasca trip. Just amazing results. I had a guy who was like literally had the plan to kill himself, but since the doctor gave him ketamine therapy,
Yep.
he got off like he was on 3 different antidepressants and wanted to kill himself. Now he's off all his medicine. He gets his ketamine therapy once a month. He's good to go. It's just amazing stuff.
That sounds about right. I mean, we've worked with this one guy, a Canadian veteran, one point on 26 different medications, right, to manage the side effects of the side effects of the side effects.
Yeah.
Suicidal, alcohol dependent, marijuana dependent, cleaned up habits. He is on testosterone and ayahuasca retreat, ibogaine. He's fucking on top of the world right now. I like that you would start with the fundamentals of like the lifestyle stuff. That's exactly what we do with our microdosing program, where like we don't even worry about touching mushrooms at all for like the first few weeks, if not a month, because I want to figure out, are you sleeping like shit? When do you wake up in the morning? Are you laying in bed looking at TikTok for 30 minutes after your alarm goes off?
Yeah.
Like maybe let's not watch drone footage of the Ukraine war while you take a dump in the morning. Maybe let's start our day a little differently, right? There's a lot of low hanging fruit to clean up before you worry about anything else. Um, how can people access this stuff? Like, is this covered by insurance? How does the VA play into it? How do you actually see people? I know you said you're licensed in 30 states. So do you do like telemedicine consults? Like, how does this actually work?
I do. So our telemedicine consult is the same thing you would get in office. So we'd be just doing it like this, because a lot of people can't get here. So That's the thing. So we sit down for an hour and we talk. For your initial consultation, I go over it. And some people have been on therapy before, some haven't, some have been on a bunch of stuff. But we try to figure out a plan for you based off of all that. So we go through it. I actually have a pad that I can write on that I can show you, like draw you pictures on how testosterone
Right.
works and where you should be and all those things that'll show up on your screen. So I do that to try to help you understand it, because this is endocrinology at the end of the day. It's pretty boring and it's difficult to understand. So I think I've refined my way of teaching it, and I feel like I try to get it explained. So we do that. We don't take insurance at all here, but a lot of the medicines that I prescribe for you are covered by insurance. Okay. So in the women's
Okay.
case, like 3 out of the 4 hormones that I prescribe, which is it's testosterone, estrogen, progesterone, and thyroid, all of them except for testosterone are covered by insurance. So that's going forward. Now I charge a management fee for that, like an admin fee. We call it like a membership is what it is. And it's a way to pay my bills. So I'm able to do it. Like, I have lawyer fees, I have state licensing fees, I have insurance, there's all these things. I have to pay my staff to schedule you. And then I have to follow up with you. And then that, I don't ever charge them for a visit. Like when I call them to go over their labs with them and check in with them, or they have a question, that's just covered by the membership fee. And it's pretty nominal. I mean, the women's is $75 a month. I think it's a pretty good deal.
That's not
Compared, I mean,
much.
people pay more on OnlyFeet, I think, than for that. So, I for the men, it's $150, and it includes their testosterone, and everything else. So, the syringes, the needles, the testosterone, all follow-up phone calls with me, all the appointments scheduled, and all that. So we do it like that. Now, if you're in the office, we do pellets. Obviously, I can't do that over the internet, so that's cash as well. But a lot of things, like my initial consultation is $200, and a lot of times men or women can submit that to TRICARE to get it covered as like a specialist consultation or something.
That's not bad at
No,
all, though,
no, for
price
a full
wise.
hour, yeah. I mean,
Yeah, yeah,
it's it's pretty good, and in the depth that we go through and the amount of information that we talk about, like it's a lot. Like even
yeah.
some I've gone some that need an hour and a half. It just depends. So that's the way we do it. It's cash only, but caveat is you can use your insurance for a lot of the medications. Now,
Interesting.
men, I always say, like, I have guys that come to me on Fort Bragg. They go for Fort Bragg, but Fort Bragg will give them their testosterone, but they're dosing it so crazy that like it doesn't help them. They're like half dosing it or something. So they're like, I don't care anymore, man. Like I'm tired of them. I'm just going to come to you and pay the fee and whatever, and just because I want you to dose it correctly. So
Mhm.
that's the reason some pay. But I always tell them, like, don't waste your money here, man. Like, if you can get it for free, do it for free. So do that. But my prices
Are,
I keep them really reasonable. I'm not trying to rip anybody off. I just try to, pay the bills and provide a good service.
are you able to see international clients at all? Like, because we have a ton of Canadian clients and they need this stuff too.
Yeah, so I have a Canadian client, but she lives here. She lives here part
Okay.
time. So she has like a job here. She works in the United States, so she's like, I think she works in both. It's like some human trafficking thing she does. So she's between the two countries,
Okay.
and so she has like a second or stays with her friend here or something. So that's how I treat her, and she happens to be in North Carolina.
Okay. So if somebody can't get access to you, what should they look for? Because I'm sure this is kind of the wild west of providers, and a lot of people are just out there to write a prescription for testosterone and take your money. So
Yeah.
how can someone evaluate like if they're seeing a good provider or not?
So the biggest thing is credentials, and there's like we were talking about before. There's so many different credentialing things that you can do to do it. To do this, you can do a weekend course in pellets, and then you're pelleting people the next day. It's just
Yeah.
insane. Like I wouldn't do a weekend Botox course and start
Yeah.
putting Botox at people the next day.
Very concerning.
So it doesn't. It's so crazy. Like you're gonna manage 4 hormones, and you could watch some videos. So I would do it in someone who's been doing this for a little while, and make sure they're either a physician, a PA, or an NP, and not just some influencer that's telling you to take these certain peptides or whatever. Like make sure they have some kind of credentials on what to do. And then the issue that you run into a lot is like, oh well, my Botox clinics are getting into hormones because they want everybody to be in house for them,
Mhm.
but they don't know what they're doing. It's just the same reason with like, I'm not going to tell you how to fix your wrinkles. So it's I think that I would not start, but just because your Botox clinic offers it, you shouldn't go there. Now, I'm not saying you should just go to an MD or DO, because there are plenty of MD and DOs that don't know what they're doing. I didn't know what I was doing when I was a ER doctor. Like I never learned that in residency or medical school. So I would go with a reputable company. The best way to do it is kind of by word of mouth. So if you have someone, ask people, because a lot of people are on hormones. They just don't talk about it. So if you're comes up in conversation, ask them. I would be like, who do you go see? Is it an online company? Is it in person? Do you like them? Are they responsive to you? Do they answer your questions? How much time do they spend with you on your initial consultation? What are the prices? Because some people, I've seen people charging like $1,000 a month for guys' testosterone, which is insane. It just to rip people off, and they put them on these medicines for no reason. And I don't know. Don't trust somebody. So just to summarize, someone who's actually been trained like a PA, NP, or doc, and then what additional training did they go to? And then what is their reputation like? I hate saying Google reviews, but they do kind of, they help you in this situation. I don't know. It's tough to really answer that question specifically, just because you got to feel people out. You got to talk to their patients, just like anything else. Do your homework.
And then judge how you feel when you're seeing them. Like, how do you feel talking to the person? And if, more importantly, how do you feel after whatever treatment they gave you? And
Yeah.
know almost like when to seek another opinion, not just take your doctor's word for it if you're not actually feeling better. Like so many people are just like, I'm like, what are you taking? They're like, I don't really know. Like, why are you taking it? The doctor told me to. I'm like, do you think it's helping? They're like, not really. I'm like, why are you doing this then?
Yeah.
Because the doctor said to, right?
I know. That's the old mentality. Now we have the internet. So
Yeah, yeah,
patients will call you out, man. Like, you better know what you're talking about. So
yeah.
patients are
All
smart
right.
now. They do their homework.
I have a couple other questions kind of in random order. Before I do that, what questions should I have asked you that I have not, to elucidate how this stuff works for someone who's struggling, maybe to elucidate what their first step should be if somebody's listening to this and they're like, yeah, I check that box, I check that box, like I don't know what to do about it. So like
Yeah.
what else do you want people to understand about this stuff who are listening to this?
I think if you're male or female and you're having the symptoms that we were talking about, go get your labs done. Now that's kind of a broad statement, because you're going to go to your doctor and they're going to pull like a CBC and CMP and they're going to be like, okay, here you go, which doesn't tell you much about anything, right? So I would specifically go ask your doctor, can I get my hormone? Can I check my hormones? And if your doctor's educated on that, they'll be able to do a correct hormone panel to do thyroid and all that stuff. But that's a good place to start, because at least you can cross some things off the list. You can say, okay, well, my thyroid's fine, but my testosterone's low, and my estrogen's fine, but my progesterone's a little low. So you can get some place to start. I would get with a functional medicine. That's another thing that's the Wild West, but someone who some integrative or functional provider that is going to talk to you about lifestyle stuff and push you in the right direction and do those kind of things. Then I always say, like, the best money you can spend right off the bat is, if you're not into exercising, get a personal trainer. I think that that's a good place to start with that. Um, Start there, start working on the basics, like we were talking about, like your sleep hygiene, start working on your nutrition, and just to give you an idea, like if you're going to reach for a cookbook, get a Mediterranean diet cookbook, just low inflammatory. Don't, if you're a female, cut out the breads for the most part. Stop eating sandwiches, do a salad with some protein on it. Because a lot of women are sensitive to gluten. I would say start there. And then get some exercise in at least 3 or 4 days a week. Try to do some strength training mixed with cardio. Start in that position, and then start working on the lab thing. I wish I had a good answer about like where to go get labs. I could tell you what labs to get. On your lab panel, you can push your doctor to do it. Just not a lot of doctors are going to do it, or they're going to screw it up. That's why we do labs in our office, because I know we're going to get what we need. You know?
Yeah, maybe you can actually give me a list. Or I think you have before actually. I'll include it in like the notes on this episode of like what exactly you recommend people go test,
Sure.
if maybe they want to go do it on their own or something, just so we have that written out.
Yeah, we'll do a
Um,
male and a female version of
okay,
that. They can,
perfect.
they can do it. Yep.
All right, a couple other questions I have, and I'll kind of rapid fire these because I know you got to get out of here soon-ish. Talk to me about stellate ganglion blocks. I recognize you're not the guy doing these, but we see quite a few people doing it. I think it has a lot of promise, but I also think it's hyped up to be like this one thing will save your life, just like the same magic bullet kind of thinking everywhere else. So,
Mhm.
how does that fit into the picture in your practice? Like, do you see people doing that in conjunction with all the stuff that you do as well?
Yes, and I've seen some really good results with it actually, to do it. So what you do is you inject it's in your the stellate ganglion is part of the sympathetic nervous system, and it goes down through your neck. And they're going to do is go in there, and it's not very deep, but they're going to go in there with a needle, and they're going to inject some anesthetic in there, which is gonna basically control alt and delete that nerve for a minute and just let it reset. And so, because a lot of these people with PTSD and all these things are in this sympathetic overdrive where they're just firing all the time. So you should be in sympathetic drive when you're being chased by the bear or the lion, but once you're in safety, you should be able to calm down. But I think a lot of people end up in this sympathetic drive constantly. And so what it does is reset it so you can let your parasympathetic take over and balance it back out. Now, I've had, my team sergeant, for example, had bilateral ones done on the same day. And he's like, man, it was the middle of the day. I went straight to my room, and he was like in this place where you go in person, inpatient and all this stuff. But he's like, I went to my room and just passed out and slept for 8 hours. I woke up.
Yeah.
And since then, like I've always been like less of a hothead. I've always been like more in control of my thoughts. He quit drinking alcohol, which is awesome. And then he said like it changed his life, and I get some people that have that. Some people need another one down the line, but not everybody's the same. You need to just reassess the patient after you do it is the big
Yeah, I
thing.
mean, I haven't had that much experience, so the population number is pretty small on this, but it seems like the people who do the best, they follow it up with some of those lifestyle changes because it
Hmm.
does offer you this like reset window. But then if you go back to all the same stuff that put you in that fight or flight mode in the first place, you're going to end up back there. So I think maybe there should be more emphasis on like the follow up, like what do we do next? But I agree. I've seen like really crazy changes come out of it. Does that have any direct effect on hormones? When we were talking about like the feedback pathways and everything like that, or is that kind of
So
a separate system?
yes, because the sympathetic nervous system is going to stimulate your cortisol production, and so you're going to spike that cortisol, which is the to survive. And having high cortisol is going to suppress your sex hormones, and so you
Mm,
end up in that state of low hormones. And then with high cortisol, you're going to, as you know, probably you're going to end up in this catabolic state where you're just breaking down muscle, and then you're gaining fat and all that. So it is going to do it. So it's nice to let it reset, and then your body can recover from all that.
awesome. All right, changing gears. We talked a lot about blast injuries and like
Mhm.
the repetitive micro trauma and sometimes macro trauma of like
Yeah,
burning in from a jump or something like that or an
right.
IED blast. Where do things fit in where someone can't really trace it to that? Because I want to be the reason I bring this up, like we use that term operator syndrome. I have a client who was a call taker for the police, so like a dispatcher, right?
Mhm.
Like not firing weapons, never ran over an IED, nothing like that. Super low testosterone, and he was super depressed because of his work, and also just modern male lifestyle, right? Fucking
Yeah.
microplastics everywhere, being overweight, not getting enough sunlight. One of the things that we really focus on, kind of the message we try to get across in our program, is like trauma is trauma, right? Like the worst thing that happened to you is the worst thing that happened to you. Whether that was getting shot or not getting hugged enough as a kid, obviously it's kind of a hyperbole, but it's true. It's like it's all relative. So where do you see that fitting in? Because I don't want someone to be listening to this and be like, well, I'm not an operator, so I guess I don't need hormones, right?
Right.
So do you kind of agree like it is for everyone? Like the operator syndrome, that's like a term that we coined applies to these people, but a 911 dispatcher might need hormones just as much as those people. Do you agree with that or no?
Oh yeah, yeah, definitely. And it's just I think the operator syndrome thing is because we have such a tight concentration of these guys that have these traumas, like mental traumas from killing people or seeing dead kids or whatever,
Yeah,
and the head injuries together. So it's a good study population. But
for sure.
there's plenty of other, like I would hate to be like, what about these cops that go and tell these people their kids are dead, and all this
Yep.
stuff like that, or the firefighters that pull like burning people out of cars. They have the same issue. It's trauma. It doesn't discriminate. It can happen to anybody. And like
Yeah.
you said, there was actually a paper I read recently, or was an article that they were talking about special operators, and most of them had childhood trauma, and so somehow
Mm-hmm.
they ended up there, and then
Yep.
the stuff that happened to them was compounded
Yep.
on top of their childhood trauma, and now this is the result.
Dude,
But
again, I'm familiar with that research, and this is slightly anecdotal, but the amount of special operators who have been sexually abused as a child is like mind-boggling. And that's
Yeah.
what we've seen so often. Somebody comes to us, they think they're all fucked up from Afghanistan. We deal with that in a matter of a few months. And now it's like, oh, like all this stuff happened to me as a kid that I spent my entire life not thinking about. And usually that's why they went and became a special operator, because they want to be a big badass dude that never happens to again and protect they want to be a protector now. So yeah, it's crazy how often that actually happens.
Yeah, it's wild, but you don't know about it because when you're in the team room, you think anybody's going to talk about that.
No,
No.
absolutely.
But yeah, I think that there's all of society could benefit if it have been suffered some sort of trauma. And a girl being molested when she was younger, that girl has trauma, some serious issues that she needs help with. So it's not just operators for sure. It's anybody with trauma.
Awesome. All right. What other books or podcasts or resources would you recommend? Just if somebody wants to start diving into this stuff before actually booking an appointment, where can the lay person go to learn more about this stuff? Do you have any good resources like that?
So I would definitely read Operator Syndrome, even if you're not an operator. I think it talks a lot about. I feel like most people, especially a young man, has had head trauma somehow. I mean, in their life, and then they've had some kind of emotional trauma. So I think that you can learn a lot from that book, and it's Eric Frew, by the way. It just came to my brain.
Okay.
It's that's the author of it, and it does talk about ways to help. So in the end of the book, he talks about like ways to go through and correct these issues, which is pretty cool. That's where I would start. If you're a woman, I would read a book called Estrogen Matters or The New Menopause by Mary
Yeah.
Claire Haver, which is a really good one. She's kind of they call themselves the menopausey. They're a bunch of female physicians, and they're like a
That's awesome.
gynecologist, a urologist, but they're legit doctors, right? And they're trained. Vonda Wright is another one where she's an orthopedic surgeon, but she's really big into bone research in older ladies. So you
Cool.
know, I don't know what your audience is, if a bunch of dudes or whatever, but if you're a dude, chances are good you have a wife or a girlfriend, you have a
That's what I
sister,
was gonna
and you have a
say. Yeah.
mom, right? You have a mom
Yep.
that you care about. So push her in those directions, and there's some good information on there. You shouldn't get all your information from Instagram. You should read some books, but and find a doctor that knows what they're doing with it, because the doctor's job is to educate you on these
Cool.
things.
I'm gonna go have a long talk with my mom after this. She needs all this stuff, dude.
Yeah, I
All
trust me.
right.
I treat so many moms right now, including my own.
Yeah, because all their sons are out there listening to podcasts. Like, mom, you
I
need
know.
hormones.
Just to give you an
All
idea,
right.
my mom is 71 years old. She's been on hormone pellets for 20 years, and she can do deadlifts and squats, and she's pretty bad, man. She can do a lot of stuff. She's
That's
still
awesome.
cognitively sharp. So
All right. Last two questions. In light of everything that you know about all this stuff, how does that impact your parenting? Like, for instance, like if I have a son, he's not playing football, dude. I got so many severe concussions that fucked me up so much when I was a kid. So, how do you think about maybe the brain development with the hormones, protecting them from insult and injury like that? How screen time affects these things? What kind of stuff is in your mind as a parent?
the number one thing is nutrition. We don't. I
Okay.
think we grew up in the cereal household. My mom was
Yeah.
pretty good, but it
Oh,
was
yeah.
like, we could. It's just at your fingertips, and it was just sugar, sugar, sugar. So we are Nazis about sugar. We will do it once in a while. If it's a movie night and we want to watch a movie together, we'll like do it once a month or something. Yeah, obviously they have a cake with their birthday, and we're not, totally crazy. But I try to eliminate all the sugar. I cook them eggs. I get up early and cook them eggs every morning with fruit, to make sure they have a good breakfast. I give them oatmeal and things that they need. Their lunches have vegetables in them. We don't do any processed food. For dinner, we try to eat like a home cooked meal, whether that's prepared by somebody else, we pay to do it, or my wife does it because we're busy. That's a big one. Football, 100% agree. I see a lot of head injuries from that. I love dirt bikes. I love riding them, but I've crashed on dirt bikes before, and I'm just so worried that like a kid's gonna break their neck,
Yeah.
doing it. What is the other one? There was another one I was thinking of. Uh, with I forget what I was going to go with that, but yeah, those are the big ones. The head injuries. Um, those I just it's just the sequelae of that. Now I see it from the
Hmm.
ER perspective. For instance, I had girls that had head injuries and got injured in soccer and got addicted to pain
Yep.
pills back in
Yep.
the day, and now they live on the street and are like, having sex for drugs and things. And I have a daughter, and I'm like, how can I never make sure my daughter never ends up in that position, you know?
Yep.
So it's very I don't know. Those are the things. Head injuries, big traumas. I like football. I played football as a kid, but I wouldn't recommend it for my kids. No.
No. And the soccer thing is funny you bring that up because like I live in Mexico, so that would be
Yeah.
the go-to sport. But yeah, heading the soccer ball I think is more dangerous than a lot of people have any idea.
Yeah.
Um, all right, last thing. I'm kind of curious just from you, because you have like such a unique perspective as a soldier yourself, and then the medical training, the ER experience, and now doing this more holistic approach, and your own personal experience of going through this hormone journey, which we barely even touched on. So like I mean I not to say that I'm similar to you in any way, but medical background, right? Like doctor of physical therapy. And then I went down to the Amazon and I learned from indigenous healers how to serve ayahuasca, right? And not that I serve that medicine now, but I teach people how to get into microdosing to heal their emotional trauma. So, like the medical side of things, the Western medical side of things, and then this holistic approach. So, what kinds of things have shaped your philosophy as it pertains to treating people? I know we talked all about it's this holistic approach, it's looking at the whole person, looking at how they're spending their time. But maybe talk to me a little bit about like how that's evolved over time, or maybe any big influences that have shaped how you look at things given your breadth of experiences.
Yeah, I think that when you get into this type of medicine, you start using the labs heavy, where you're
Mm,
just like, you want it to be like regular medicine, where you're like, okay, what I'll do is just order a lab panel on this guy and I'll figure it out. That's what we do in regular medicine. Oh, the potassium's low, I'll just fix it. The magnesium's low, I'll just fix it. That's easy, I'll just give him that. But it's not like that. I think the longer you do this, the less I rely on the labs for it.
mm,
So for instance, I'm trying to teach my buddy who's a PA in the ER, and I'm trying to teach him how to do this so he can come and work here. But I don't have a way to explain things sometimes of like how I chose how to do that. I just
right.
sat down, and there's someone who said like, if you can't figure out what's wrong with the patient, you haven't listened long enough. Because if you listen for long enough, they'll tell you what's wrong with them. And so you have to sit down and just talk to them and listen and ask the right questions. And I think you don't know how to do that right off the bat. But as you get old,
For
as you
sure.
get more experienced in it, you start learning that like labs are helpful, but really like it's more about like the symptoms, and you learn what works and what doesn't. That's
Would
what's
would you
really
say with relying less on the labs, you're almost letting go of this need to understand everything and like this need to be able to explain everything on paper? Like, do you still try to find a root? Like, do you try to find a mechanism or an explanation, or do you almost leave some room for like mystery? But it's like, hey, I put you on this and you feel better, so let's just accept it.
Yeah, you just nailed it, like perfect.
Yeah.
So
Okay.
I have that conversation with patients sometimes, and I'm like, I don't know, your levels look like this, but you feel so much better here. So why don't we just leave you right here? Like,
Yeah.
let's leave you on this dose. Like I care more. I always tell them, like my patients, I say, I don't treat numbers, I treat people. So if you feel better doing this and it's safe, and it's safe for you to do, then let's just do it. It's not
I like
not that
that.
big a deal. Whereas, like, I think when you're new and you start out, you just try to like, oh my God, I got to stay within the parameters of these numbers, the high and
Yeah.
the limit, But I don't know. The best doctors I've ever learned from are just, you would look at them and be like, what the hell are they doing? If you looked at the labs of these patients, but the patients are like thriving, it's so cool. So,
I
yeah.
feel like that actually requires a degree of humility as a Western doctor to be like, I don't know what's going on, but my patient's responding, so I'll call this a success. Because
Yeah.
we just our brain just wants to understand everything. And I feel this way with the work that we do. It's like, dude, the human brain by definition is not equipped to understand absolutely everything that there is to understand. So all that I need to understand is what levers can we pull that are going to make you feel better, and let's just go in that direction. So that's
Yeah.
really cool that you've kind of arrived at that same thought in a very different field of work than what I'm doing. So I like hearing that a lot. And Dude, for me, I'm really looking forward to fucking referring some people to you and getting our clients some better outcomes now that we're actually looking at the hormonal side of things as well. I think that's going to be really cool. So,
Yeah,
dude,
I'd be
thank you so
happy
much
to
for your
take.
time, man.
Yeah, no, thank you. It's been a pleasure, and being on your podcast. Thank you so much for having me. It's been wonderful.
All right, so if you like what you just heard in this episode, check out those books that Dr. Bosley recommended. We'll have links to all those down in the description. Check out Dr. Bosley's site and his practice. If you're in the area or really anywhere in the United States, you can hopefully get access to work directly with him. And maybe we'll have him on again one day if you guys have some more questions and we want to do some follow-ups, talk about some more specific things. I know I have a million more questions that I didn't get to ask him. So if you're listening to this and you've got some specific questions for Dr. Bosley, drop them in a comment on this episode or send them to me and we can try to take care of that in the future. So huge thank you to Dr. Bosley for coming on here. Huge thank you to you as well for listening. Hope this episode was helpful, and until next time, peace out. Hare Krishna.